Welcome back. This is part 2 of 101 addiction counseling terms, a 4-part video series you can use for exam prep, continuing education, or just building your understanding of addiction treatment. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. In this video, we're covering terms 26 through 50, and just like in part 1, I'll break them down in plain language and provide an example to help you remember the meaning. Feel free to pause, replay, revisit this video as many times as you need. It's here to support your learning. Let's get into it. Let's review what you'll get out of this video. First, you'll learn essential terms that commonly show up on addiction counselor exams. You'll hear each term explained in plain language, no fancy words or jargon, so it's easier for you to understand. You'll also get an example of the term, helping you to connect the terms to what actually happens in the clinical setting. This video is made to help you recall terms for both multiple choice questions and case-based scenario questions. Overall, you'll build a strong foundation in theory, ethics, treatment planning, and documentation. Term 26 is outcome measures. These are tools counselors use to track client progress over time, like symptom checklists or goal tracking forms. For example, if a client's depression score drops over 6 sessions, that's a measurable outcome of therapy. Term 27 is dual diagnosis. It means the same thing as co-occurring disorders. A client has both a mental health condition and a substance use issue. Both need to be addressed in treatment. Term 28 is counselor self-disclosure. Is when a counselor shares a personal experience or a personal piece of information about themselves with the client. When done ethically and carefully, it can strengthen the therapeutic bond. For instance, a counselor in recovery might say, "I've been where you are," to show empathy. Term 29 is open-ended questions. These type of questions get clients talking and help you gather information. Instead of asking questions that can be answered with a yes or no, ask things like, "What led you to come here today?" Term 30 is coping skills. These are healthy ways clients deal with stress or cravings. You'll help them build a toolbox that works in real life, especially when triggers show up. Term 31 is continuum of care. It's the full range of treatment levels from detox to aftercare. You want the right level of care at the right time, depending on the client's need. Term 32 is boundaries. In reference to the clinical relationship, boundaries keep the therapeutic relationship safe, like not accepting gifts and not dating clients or previous clients. Term 33 is code of ethics. Every credentialing board has one. Knowing the ethical standards for the profession you work in, ours is counseling, is important. We learn about confidentiality, supervision, and client care. This is critical for passing the exam, but most importantly, for doing the job right. Term 34 is involuntary commitment. This happens when someone has to go to inpatient treatment because they are a danger to themselves or others and can't make safe choices. It's a legal process and you may have to assess for this in crisis situations. 35 is strength-based approach. Instead of focusing only on what's wrong, we focus on what's working. For example, helping a client recognize they've already stayed sober through some tough times. Term 36 is reflective listening. It's more than repeating. It's showing that you really get what the client is feeling. It builds trust and keeps the conversation going. Term 37 is reframing. It helps clients see the same situation from a different angle. It doesn't dismiss the pain, but it brings in hope. Term 38 is objective data. It's what you can observe, not what you assume. Document what you see and not what you feel. Facts only. Term 39 is subjective data. This is the client's voice. This is what they're reporting from their point of view and their experience. You'll combine both subjective and objective info when writing notes and assessments. Term 40 is functional analysis. This is where you help the client understand the pattern, trigger, behavior, consequence. This helps build insight to better coping. Term 41 is intervention. These are the things you do as the clinician in session, like using motivational interviewing, facilitating a psychoeducational activity, CBT, and other tools that help the client address their issues and change behavior. Term 42 is documentation. If it's not written, it didn't happen, at least in the eyes of your agency, the courts, and insurance. Make sure you are documenting all of the things you're doing when you are working with clients. Term 43 is thought distortion. It's when thinking becomes exaggerated or inaccurate. Understanding thought distortions help clients identify and challenge these thoughts, especially with CBT. Term 40 is family systems theory. This theory reminds us no one exists in a vacuum. Family roles and patterns often play a big part in addiction and recovery. Term 45 is collateral contact. It's when you check in with someone else involved in the client's care, with consent, of course. Inpatient treatment means the client lives at the treatment center full time. This higher level of care is for people who need structured care and support around the clock. Integrated treatment is when someone is getting both substance use and mental health treatment at the same time. Both disorders are being treated together for a higher outcome of recovery. An interventionist is someone who helps guide families through one of the toughest conversations they may have to have with the loved one about getting help for an addiction. It's a planned conversation, and the interventionist is there to offer support and show the person they're not alone. Term 49 is long-term residential treatment, and this is when a person needs residential care beyond 30 days. This is for people who need more time to stabilize and build those recovery skills. Term 50 is MAT, and it stands for medication-assisted treatment. This is when you combine medication with therapy and other supports to increase the likelihood of recovery. For example, someone might take methadone and also attend counseling sessions. It's all about support, structure, and safety. It's time to quiz yourself. Let's check how well you remember the terms from this section for terms 26 through 50. I'll read each term out loud and give you a short pause so you can say the definition in your own words or jot it down. Don't worry about getting it perfect. It's about practice, not pressure. Let's begin. Outcome measures. Dual diagnosis. Counselor self-disclosure. Open-ended questions. Coping skills. Continuum of care. Boundaries. Code of ethics. Involuntary commitment. Strength-based approach. Reflective listening. Reframing. Objective data. Subjective data. Functional analysis. Intervention. Documentation. Thought distortion. Family systems theory. Collateral contact. Inpatient treatment. Integrated treatment. Interventionist. long-term residential treatment, and MAT. Here are 3 easy learning tips to remember these terms. 1. Explain it out loud in your own words. Read the official definition and then figure out a way to use your own words. 2. Apply real-world, easy-to-remember examples. You're more likely to make the connection and remember the definitions. And lastly, quiz yourself often. Make sure you are consistently quizzing yourself, whether it's a brief 5 minutes or watching my videos on Tiesha Talks Mental Wellness. Make sure you give me a like and subscribe to my channel. I'm going to upload new study videos every week.